everybody be able to hear this important information. The presentation is in English, but we eventually will be posted in Spanish as well. So all the information will be available. So as usual, a large agenda with lots of important information, but we also wanted to take a minute to do a year-end review and just look at all the important things that happened over the last year and some information coming up, because the work never ends. And we wanted to make sure nobody missed anything and you got all the information available to you. So we'll go through an overview. We'll follow up on some questions we received. We'll do, highlights from 2024, as well as information about highlights for 2025 that you can expect. And then just some kind of near-term news you can use for information or initiatives that are coming up. All right. So we do want to see who's here today, and we wanted to take a minute. If you haven't ever used Slido, this is your fun chance to use Slido. So it is, if you take your phone, my phone's not doing it, I don't know why. If you go to the QR code that's on your screen and go to a website called Slido and put in the password, we can just kind of find out who's here in the room. So whether you're a child care center director or a family child care provider, you can answer right on your phone, and then we can see the information as well. Group family child care, legally exempt, after school, or other stakeholders, that would be great. And it looks like we have a lot of others, which is great. Lots of child care center directors, good morning, and teachers, good morning, as well as after school, family child care providers, fantastic. A great mix, almost 60 folks here, 8 a.m. Monday back, fantastic. Lots of others. Curious to dig into the others at some point. But thank you to the center directors and teachers who are here, and I think you can see on your phone as it comes who the attendees are as well. Good morning to our group family child care providers and after school providers. Thanks so much for being here. Oh, great question. We could drop the link in the chat. I don't know if we can do that, but or if we can send it out as well. But we can go to the next slide. All right, so we're gonna go first and just talk a little bit about this webinar series. We launched that this year, 2024, as a way to get information directly to our child care providers. And it will continue to occur bi-monthly, though we do have a poll at the end to see if there's information or other information you would like. We will have simultaneous interpretation in Spanish by our colleagues, Andres and our colleagues at NICEDEC. You can always send in questions or topic suggestions into our email box and just include community conversations in the subject line. And then if you miss the call, no problem. The recordings and the slide deck are all posted online on the link that you see here. So we'll be sending this out as well, and it's also included in the Division of Child Care Services newsletter. So you can always follow up afterwards as well. So people did send in some questions, and we wanted to just spend a minute to answer some of those questions. You can go to the next slide. Sarah, when you're ready. Thanks. All right. So the first question is, how is pre-K affecting enrollment? And connected is, how can we have an update on the State Education Department OCFS Collaboration Council? So those are delightfully connected. We do know there is a direct correlation between the launch and continued expansion of pre-K in different parts of the state. And of course, that has sometimes in those areas a negative impact on enrollment of 4-year-olds in our child care setting. So we do know that that is a reality in a lot of parts of the state, especially as some school districts expand their pre-K or expand the seats. But our colleagues at the State Education Department recognize that we have this interconnected systems. And so together with them, we launched the Collaboration Council this year and had a chance to meet twice so far. We're going to meet 2 additional times. And on the council are home-based providers, CSDA home-based provider union, as well as center directors that do partner with school districts, center directors who don't partner with school districts from all around the state, upstate, downstate, and as well as school districts and BOCES and other school representatives. And then our CCR&Rs and our other stakeholders who are collaborating and help with that collaboration and support providers. So on the Collaboration Council, the goal is to develop recommendations to really look at how these systems are interconnected and how, when pre-K expands, how can we make sure that we can lessen that disproportionate impact on child care settings that might be already caring for those 4-year-olds. Because a 3-year-old will be a 4-year-old, will be a 5-year-old. It's all one family, it's all one system. So we do know there's an effect, and we're hoping to issue recommendations by like mid next year, maybe May, I think is the goal. And those recommendations will go to our commissioner as well as the commissioner for the State Education Department, as well as be public so that we can have those public conversations. The last question was on enrollment. I think some of the concerns were around enrollment. How can we get help with enrollment of families? I think some providers are seeing low enrollment and other providers not, but we weren't sure if this question was specific to our child care assistance program or if it was just general, how can we get help with enrollment of families? So generally, if you're looking for enrollment and looking for ideas to reach out to families, we would, of course, make sure that you connect with your child care resource and referral agency. The CCR&Rs have a lot of tools that they can help with, and we are working really closely with them so they can connect you with kind of more local or regional resources that can reach out to families or employers to reach out. And as far as enrollment of child care assistance, I don't know, Meredith, if you wanted to address that question.
Good morning, Nora. I think we need a little bit more information, so I would ask if there's someone who has a particular question that you send it our way. I know that sometimes there's questions about having families added to your case if it's a New York City question, and we can direct you where to go for that, but also sometimes it might be specific to legally exempt enrollment and whether there's delays in getting families started. So a little more information would let us better answer the question.
Got it. Thank you. So, but does flag that if you do send in a question, we would love for you to include as much information as possible so that we can answer it as completely as we can. So thank you for those. And then we are going to jump in and really look back at some of the highlights from 2024. I think our first slide is for Joy. There she is. Hi, Joy. Good morning.
Hi, good morning, everyone. So we wanted to just remember that DCCS was out and about the state this past year in 2024. We had members of the leadership team presented at NYPWA in both the winter and the fall. We were able to have a conversation at Cornell's Town and Gown Conference. We did not just early childhood, but we were able to have a big presence at the New York State Network for Youth Success Schools Out Make It Count conference this year and hope to do that again. We were at the CSEA Voice Conference, as well as the Family Child Care Association Conference, again, wanting to make sure that we are able to have one-on-one conversations with all of the family child care providers out there. We also had a presence in 2 national conferences, one the NARA, or the National Association for Registrars. I think I missed an A.
Regulatory agencies.
Thank you. our licensing seminar and leadership symposium, where we had a really strong conversation with other states around how we are thinking about quality and collaboration. And we also presented at the Association for Public Human Services Association. Yay! Okay. I'm getting my acronyms this morning. Webinar, again, a national conversation with other states about kind of looking forward after pandemic funds have gone away, what's next. And then we had OCFS track at the New York State AUIC annual conference. So we had multiple sessions across 3 days of workshops, and we're looking forward to being there again. So if you attend any of these conferences, please come up and say hi to us and attend our sessions.
Thanks, Joy. And then all of these presentations are online. So if you are just curious what we presented on, you can always look for the information that is online. So we post all of our presentations on our website, and the link is at the bottom there. So in 2024, we also made an additional payment for, you can hit the next slide, Sarah, when you're ready. Great. We made an additional payment for the Workforce Retention Grant. This was the last of the payments for the pandemic funding. And so we were able to send out additional workforce retention payments to 12,000 programs. It totaled 256 million additional funds. So these were the last of the pandemic funds. And over 72,000 staff received that additional bonus, which is fantastic. So we're excited that we were able to push those funds out. We very completely spent all of our pandemic funds. No funds are being returned to the Fed. In fact, we maybe overdid it a little, but we overdid it on purpose so that we didn't send any back. And then we do have a breakdown here of where the funds were expended. So these funds went to, as you know, staff got a bonus, but there were also funding towards programs and how programs use that for recruitment and retention. And so this breakdown here is how programs used those use that funding for additional outreach or additional bonuses. There was obviously bonuses for staff in caregiving roles, which weren't eligible for the $3,000 bonus, but also were eligible in this Part B, Component B, as we call it. So we're very excited that we were able to get those funds out and spend. We don't have any update on whether or not that will continue in the future, which I know is always a question. I'm surprised I haven't seen it pop up in the Q&A yet. I don't have any information on that because this was a once in a blue moon opportunity. So the majority of the $2 billion that New York State received for pandemic funding, over $1 billion went directly to child care providers, and the majority of that billion went primarily to child care providers' staff. So we're excited about that. All right, I think I'll hand it over to Jim.
Sure, good morning. Hopefully you can hear me okay. I'm having some technical challenges this morning. But another initiative that we wanted to highlight from this year was our Pack and Play initiative, which was really an overwhelming success. We distributed over 8,500 Pack and Plays to over 5,000 programs. And due to the overwhelming response, we are currently pausing as we exhausted the supply inventory that we had. And we'll be providing some additional information when we're able to resume this. This really reinforces our commitment and efforts to promote safe sleep in our childcare programs. For additional information on safe sleep, you can click on the State Department of Health website link that's included in this slide deck. But we really were excited about this initiative. These were at no cost to providers. There was an electronic way to apply for this initiative, and we exhausted our supply inventory. It was so well received. So more to follow as we are able to replenish our inventory. So with that, I am going to turn it back over to Nora.
Thanks, Jim. I do see the questions in the Q&A box, so we will get to those. So I'm just letting you guys know, if you do have questions related to what's on the screen or not, feel free to throw it in the Q&A box. I'm just going to leave those till the end, if that's okay, and we'll definitely get to those. If there is a question on anything that we're presenting, we'll try and pull it in, but we definitely will get to all the questions if you throw them in the Q&A box. All right, and good morning to everybody who joined us. Thanks for being here. This is the Community Conversations. We're doing a little year in review. Also this year, we launched a childcare data webpage. This webpage probably has all the data you'll ever need. If you're ever writing grant applications or you're writing letters and you need information on, you know, any number of like programs or the Child Care Assistance Program. So the link is here, and it includes not just information on providers as well as maximum capacity in New York and specific parts of New York. We also have partner data on there, including data from the Early Care and Learning Council on referrals to childcare and the State Education Department data. So if you ever need information, feel free to reach out. And if it's not on here, we'd love to put it up there. So hopefully, you know, promoting transparency and as much information as we can. And then I'll hand it over to Meredith.
Thank you. And one of the fun things that you can see on our data page is we do post trends on utilization of the Child Care Assistance Program. So I'm very excited to show what the trend has looked like this year. The number of children and families receiving child care assistance services measured in a single month has increased by 33% in the past year. So clearly we are starting to see a lot of the benefit of the increase in eligibility levels and standardization of the program. So that's an increase of approximately 20,000 families or 34,000 children per month that are being served through the Child Care Assistance Program. And if you look at the graph on the chart, you can see we are now the blue line is the rest of the state. The red line is New York City. You can see New York City is running right about where they were pre-pandemic. That's what that big drop is in the line. And the rest of the state is actually now very close to what our all-time high for serving families was, which was several years pre-pandemic. So great growth in the system and really exciting to see what's happening for New York State's families. And I can't wait to show it to you next year. So that's just one little example of the sort of thing that you can find on our data page. And with that, I think I'm going to pass it back to Sarah for a Slido.
Yep, and if you give me 1 second, I will actually pull it up on the website screen so then everyone can see the responses coming in as well. In 1 second, I'll pull that up. And everyone can look at it. All right, if you should be able to see my screen with the QR code and the question.
We just want to find out if you are taking care of children in receipt of child care assistance. So would love to see if you're one of those folks taking care of families on that chart. So if you are a child care provider, do you care for children receiving child care assistance? Yes, no. And I would say if you have, but maybe they're not there currently, maybe you have in the last year, you can definitely say yes. Maybe the family is not there currently, but that's great to see 88%. Fantastic. There's only 16 of you participating yet, and then there's 82 of you on the call, my friends. So let's see how many, if you are a child care provider, are you currently caring for children with child care assistance or subsidy, or also called subsidy got a couple folks who are on their phone, so they can't do the QR code, so that we understand that. That's great. The voting seems to have slowed, Meredith, but I think that's a resounding yes.
I would say so as well. So as your numbers, if you are just getting to Slido, you can continue voting because we will take a look at these after. I'm seeing a few more come in, but it looks like we are close to 90%. So I would call that an overwhelming yes. Okay, I think we'll go back to our slide deck and I'll share a little bit more about what's happened with the Child Care Assistance Program in 2024. And I'll just give you a minute to get that back up. I think most of you have heard us talk about the online child care assistance application, but if you haven't, I'm going to give you a brief overview. And if you have, I just want to share a little bit of an update in terms of how it's going. So we developed the online version of the OCFS 6025. That's the child care only application. And that was launched in July of 2024. The number I have on the screen is 2,377 applications completed as of November 1st, 24. Because December 1st was yesterday, I wasn't able to get the full completion numbers, but we're hovering around 3,000. So our numbers have gone up dramatically in the past month. The Child Care Assistance Application, CCAA, allows parents to apply online. It allows the districts to communicate back with parents, so it's bi-directional. It does require an ny.gov login, but once you have that set up, parents are able to apply online, submit all of the information that they need to complete an application for child care assistance, including uploading your pay stubs or any other supplemental documentation. So we've seen great success in this. It is used around the state with the exception of New York City and Schenectady County. They both have a slightly different online application. But ours is the one that's used around the rest of the state is the only one that allows our local social services district staff to communicate directly with families on that application. So very excited to see the progress that's happened with that this year and looking forward to see what comes of it in the coming year. If we go to our next slide, I'll give a quick update on direct deposit. As most people know, phase 1 was deployed in July of 2024. We had very good success with that. Phase 2 was deployed in October of 2024. And we are looking at a phase 3 deployment date of January of 2024. Right now, we're working with our local districts to make sure that they're ready for launching that. So far, we have made over 3,000 payments through direct deposit in phases 1 and 2. The actual number is 3,095 payments for close to $13 million in payments that have gone through that system. So as we're looking at our launch date for phase 3, we are carefully evaluating our timing because we know we're coming up on the holidays and we don't want anything interfering with payments to providers over the holidays. As we evaluated the capacity of people to troubleshoot any problems, all the other things that are going on in people's lives. We've realized that significant change in December might not be the easiest thing for providers or our social services districts to handle. So we will be sharing information on our deployment in the very near future. And I think that that was it in terms of our updates for the Child Care Assistance Program. At this point, I'm going to turn it over back to you, Nora, or is this?
Sure. I will just say, Meredith, there's a couple questions on, yes, Denise, thank you. It's January 2025, not January 2024. Good call.
Oh,
we are not going in the past and going to complete that. Meredith, do you want to take the child care assistance questions now or at the end? Because there's a couple questions on child care assistance. Your call.
I just want to make sure that we get through all of our slides and I don't hog all the time on child care assistance. And then also if people have others, maybe I can group them. So I'll start taking notes. And if you can pass back to me, I'd be happy to.
Fantastic. Fantastic. All right, Emily, over to you.
Great. Good morning, everyone. So this year, we also continued the work of the Governor's Child Care Availability Task Force. The task force reconvened in March of 2023, bringing together various stakeholders and providers from across the state. The task force was charged with building on the work of the 2021 report, which is posted online, examining the impact of the COVID-19 pandemic on the child care sector, advising the state on a phased-in rollout of universal childcare, making recommendations to address the childcare workforce crisis, and assessing the impact of the federal pandemic funding. So the task force put out a report of recommendations in April of 2024. The only thing left to do for the remainder of 2024 was to work on that large chunk of work on the advising the state on a phased-in rollout of universal childcare. So since the report was published in April, the task force has been working on that implementation phase-in plan, and the implementation roadmap is anticipated to be published soon. And we have all of the information about the Child Care Availability Task Force, the 2 previous reports, the statutes that govern the body, and also recordings from previous meetings available on our website. So please, if you're interested in what the reports say, I would encourage you to take a look at those. And I think I am passing it now to Joy.
Thank you, Emily. So another exciting announcement that happened in 2024 is that we launched a $50 million reimbursement grant for capital programs. And those that were eligible were nonprofit and for-profit childcare centers, as well as school-age childcare programs and permitted Article 47 programs in the city. The grant is administered by the Dormitory Authority of the State of New York, or DASNY, and the award list of 45 sites in all 7 regions of the state was posted in September and can be found at the link here on the slide. And we are so excited to see these projects getting up and started, and can't wait to cut some ribbons in 2025. And I pass it back to Nora.
Sure.
Oh, nope, I think I keep going.
You keep going.
I do. So we wanted to just kind of refresh everyone's remembering of the community conversations that we've had thus far in 2024, and to remind you that the recordings are available on the website. And so in April, we had a conversation around inclusive spaces for children with special needs. We had a wonderful guest speaker, Bridget Desport, who is an occupational therapist and an adjunct professor, associate professor at SUNY Downstate. She provided a wealth of resources, which can be found at that Google Drive link. I encourage you to go not just to see the recording, but also to access the wealth of resources that she provided. Some of the key information that was discussed was about how to create a welcoming school environment for all, and how to connect a welcoming home environment to the childcare program. So really lots of conversations about structuring different spaces, how to adapt and adjust activities so that all children are able to participate, about recognizing that every home is different, and to facilitate some really heartwarming and open conversations with families, both around what's working well at home, as well as what is working well in the childcare program. It was a wonderful conversation, and Brigitte has a wealth of knowledge, so I encourage you to look back at that conversation. Next slide.
The next slide is actually another Slido, so I'm going to pull that up on the website again so that everyone can vote. Just give me 1 second, and I'll pull that up. Right. Ooh, everyone's voting. Let me get this up. All right, so you should be able to see it now.
Fantastic. So if you are a child care provider, does your program partner with any of the below programs? And you can select all that apply. So other community organizations who serve children with special needs, our early intervention 0 to 3 partners, our preschool special ed for our 3 to 5. And then if you're not currently partnering with any organization for children with special needs, that's an option too, but you can select all that apply here. So you might have a kid in early intervention, then that kid may transition to preschool special ed after they turn 3. There may be other community organizations. I'm curious if you did select other. Curious if you can, I would love to know who they are because we would love to get in touch with some of those amazing organizations doing the work. So if you can, if you're on your computer, would love to, if you could include in the Q&A some of the names of those organizations that you're currently partnering with. Always looking for good new partners. Awesome. That's great. Thank you, Barbara. Looks like early intervention and preschool special ed are 2 of our top partners, which is great, but tied with those other community organizations. So those more probably regional and local resources. Awesome. All right, Joy, it looks like the voting has slowed. If you want to, we'll leave it open for those of you that are, sometimes the QR code doesn't work for me. So I get that.
Sure, happy to move on. So another conversation that we had this year was around the state's resources for infants and toddlers. And so we had Jamie Flynn, who's an infant toddler specialist at an infant toddler resource center, which we have throughout the state, as well as Susan Panarella, who is an infant toddler mental health consultant, join us to discuss this topic. And so the Child Care Resource Centers, also known as Child Care Resource and Referral Agencies, house the Infant Toddler Resource Center, which includes infant toddler specialists and infant mental health consultants. So all of these words can be confusing, and we wanted to make sure that we were communicating out to providers what are the differences and how can you get access to these services. And so the local CCRCs are available to have further conversations in your community around what is available, but wanted to really highlight why infant toddler mental health is so important. We can often, when you hear the word mental health, it can be somewhat off-putting, and so we want to make sure that we are helping to alleviate fears, that we are not doing one-on-one consultation with infants or toddlers, but it's really about how are we fostering positive attitudes towards early childhood mental health or mental well-being, and what we know is that starts in those critical ages of 0 to 5. And so it's important that the staff who are working with infants and toddlers have access to additional support. And that's where an infant toddler mental health consultant can come into play. And they can help to empower the caregiver to understand their impact on a child's social emotional development. They can also really think through developing daily self-care routines to reduce the stress levels of caregivers. And they can also refer to an infant toddler specialist for kind of more general supports around the infant toddler environments, accessing and creating policies and procedures that are responsive, particularly developmentally responsive. And then they can provide support for both the in classroom teacher or in-home provider, as well as for the director of the center. So we had a really great conversation, and hope that you will connect with the infant toddler resource centers in your area to get access to these services. And I will pass it to Emily.
Thanks, Joy. So we also had a great conversation at the August community conversations with folks from the Child Welfare Division of OCFS to talk about the HERES family line, which HERE stands for the Help, Empower, Advocate, Reassure, and Support family line. And we have the information here on this slide with the number and the link to the landing page on the OCFS website where you can get more information. So the HERES line is a OCFS run line that assists families and individuals by providing resources and referrals to a variety of services. So caring representatives will answer a call from a family and guide folks to services that include food, clothing, housing, medical and behavioral health care, parenting, education, and childcare. It was implemented in April of 2022, and the HERES line has answered since then over 4,200 calls from New Yorkers in need. And one of the goals of the HERES line is to provide supports to a family to mitigate the need for child welfare intervention. So in some instances, if someone in the family's life or the family themselves is looking just for referrals to resources and connections due to a myriad of circumstances, they can call the HERES line and get that assistance. So how the HERES line works is those HERES specialist listeners will answer a phone call from families, listen to their concerns, and determine what needs the caller might have and work to connect them with services. Sometimes the specialist may connect the caller directly to a resource for a warm transfer. The specialist, kind of in real time, will research options and compile a list of resources in the caller's area and call or email that family and call her back within 24 to 48 hours with a list of resources. Occasionally, the HERES line does receive emergency calls, and they work with the regional offices and other program areas to link callers to assistance. The OCFS HERES line does not provide direct services or case management themselves, but is really just that kind of warm connection to local resources for families. And, it's a additional resource that, providers like yourselves or other professionals that work with children and families can utilize when you see a family in need and think that they need maybe some additional assistance getting connected to those resources. And with that, I will pass it to Jim.
Okay, so this next initiative that we wanted to highlight again is the Military Child Care in Your Neighborhood program. During our last community conversation in October, we actually had representatives from the Department of Defense do an overview of this initiative. New York State was selected to participate in this program just over a year ago. So we've been participating in this initiative for over a year. It offers childcare assistance to active service members, reserves, component members, and DoD civilian employees. It helps them locate and select childcare programs and offsets the cost through a fee assistance program. Programs in New York State are eligible to apply as a licensed and registered child care program. Outside of New York State, programs frequently require additional accreditations or credentials to participate, but in New York State, holding a license or registration makes a program eligible for participation in the MCCYN Plus program. That's how it's commonly referred. We do have additional information and resources on our website if you have more questions. We strongly encourage you to review that if you think this is something that you would like to participate in. And moving on to the next slide, which is additional important information we want to highlight this morning. So moving on to the next slide, we've really worked to develop a lot of resources for our childcare programs and publishing that information on our website. And we have a section on our website under CCDBG, under the background checks. And I know we have a lot of questions about that, but we've also developed a lot of resources to support programs. So we want to reinforce the information that is available, specifically around FAMS, and using FAMS to submit and complete the comprehensive background check process. So we want to just reinforce and point people to the resources on the website. If you have not seen them, please take advantage of the information that's there. We are continuously developing new resources. We have prior recordings of webinars. There's video tutorials and additional frequently asked questions information on how to use FAMS. In addition, we are regularly offering live technical assistance sessions, which we've been doing both in English and in Spanish, and also offering them outside of the normal childcare workday so that it's accessible to programs. So we've been offering evening sessions as well. There's information on how to register to participate in those technical assistance sessions. And we also have a link to a user mailbox. So if you're in FAMS and you have questions about how to complete a certain screen or field in the system, you can always email this mailbox and staff will get back to you and guide you through the process. A lot of times we'll arrange a phone call to actually walk you through anything that you're encountering or experiencing and need assistance with. So we are moving into some additional new resource formats as we go forward to make some more interactive experiences on the website, so that it's not just watching a video or reading something, where you can actually click through and navigate through some new resource screens that we have on our website. So highly, again, recommend that you frequently check the website for additional information on FAMS and background checks, in addition to a lot of the other information that we regularly update and post on our website. So with that, I am going to turn it back over to Meredith.
Jim, I just wanted to take a minute to talk about our market rates. Our new market rates did become effective on October 1st of 2024, and the market rates are posted on our website via our local commissioner's memorandum. That's 24 OCFS LCM 2022. The market rates were set at no less than the 80th percentile of the prices reported by providers on the most recent market rate survey. And in some instances, they were set above the 80th percentile in order to provide a minimum of a 5% increase from the 2022 market rates, in order to allow providers to better meet health, safety, quality, and staffing requirements for high quality childcare. If you're a provider that serves only families with childcare assistance, you can submit the OCFS 6060. That's the form to attest that you only serve families with childcare assistance, so that your rate is the market rate, and that would result in an increase. If you haven't yet filed the 6060, payment can be made retroactive to October 1st, 2024 through the end of this year. So that it's very important that that form is submitted. If you serve families that receive childcare assistance as well as private pay families, you need to work with your local social services district to make sure that they have your current private pay rates. In New York City, there's a standalone form that is on their website. individual county by county outside of New York City. You should know who your contact is for your child care assistance payments. And anytime you change your private pay rates, it's really important that you share that information, because if you are charging more than the market rate and that's in our system, then that information is already there at the time that market rates take effect. And I'll post some links when we get to answering questions at the end, just to direct people if they are curious about those forms or other information for New York City. And as always, direct people back to our website where there's a ton of information on the market rates. And with that, I will pass it on to Jess, and she can talk about our impact project.
Hi, everyone. So I'll keep it really brief because I know we're short on time. So this past year, we've been working hard to create a statewide definition of quality childcare. And the goal here is to be really transparent and inclusive in how we're doing this. So what we've done is this past year, members of DCCS reviewed literature and resources around what quality is and what it could be all around the country. At the same time, we created a survey that we released to the general public. So we got almost 5,000 responses from parents, providers, and all sorts of interested parties about what they think quality childcare looks like and what it could look like in New York State. So we've worked to review and analyze those data and those responses, and we're trying to think about how we can use that information to draft a definition of quality. Our next step is going to be to continue to draft this definition of quality and to gather public input, including input from providers, as we start to kind of workshop what this definition could look like. So that's what we're looking at both for last year and looking ahead.
Thanks, Jeff. So we are doing amazing on time, but we're going to keep moving relatively quickly. So thanks. I see folks are starting to drop off because I know the morning gets chaotic, but we are so grateful that everyone is here. So I just want to say thank you before we run out of time. So very grateful that you're here, grateful that you're participating. So on to 2025. We are so grateful you're here, and we do want to communicate as that works best for you. So we did create a short survey so that we can learn a little bit about what timing and what frequency and other things work best for you. So if you are still have that phone nearby and want to use the QR code, we're going to just ask a couple questions about communication and how best to get you communication, probably in a couple different ways, right? Because we're all very busy, and so we have limited time to get through stuff. But the survey will stay open, and then we'll use that for kind of planning for 2025. I wanted to just spend a minute talking about the Child Care and Development Fund plan. So this is a plan that New York State has to draft. You can go to the next slide, Sarah, when you're ready. This is a plan that New York State has to draft to the federal government to tell them how we're going to use the federal funds that New York receives for childcare. And so we drafted the CCDF plan, submitted it in July. We just received November 8th the approval letter and the approval of the plan. So that is all finally posted online. We knew that there were certain pieces of the plan that we were not going to be compliant with. So those are the items that just got passed in April of this year. So we knew not yet that we're not there yet, but we are working on those things. So all of that information, the letter, the plan, and also waiver information is all posted on our website. And then the next steps will be both implementing it and addressing those waivers and addressing those action plans for those items. All right. So the last thing we just want to address, and I do want to get to questions. Maybe, Sarah, maybe we skip the Slido because we only have 5 minutes left.
Okay.
Maybe we'll skip that last Slido. Yeah. I think that's fine. Want to make sure folks see our quarterly newsletter. So if you haven't seen it, please let us know because we send it to the email address that's in our licensing system. So we are sending out quarterly newsletter with a lot of information and wrap up. And then I do want to just leave on the screen the contact information for future topic suggestions. And then quickly to the questions. One is I'm in the process of applying for a license for a new group family daycare. but it's too soon to hire an assistant. However, that assistance would need to be fingerprinted. So all of those fantastic licensing questions, we encourage you to talk to your licensor, your soon-to-be licensor, at our regional offices. So I'm not sure, Dee Dee, what region you're in, but there are 7 regional offices, and hopefully you're working with one of them for your application. And all of those questions about the requirements about your assistant and the fingerprinting process, they absolutely can help you with. If you also are not yet working with your child care resource and referral agency, also encourage you to connect with them. Speaking of clearances, Nelson asked about why it takes so long. We understand it can take long. A lot of stuff is in our control and a lot of stuff is not. Some stuff is not. So sometimes background checks take a while if the person had lived out of state, and some states don't cooperate with New York for some of our background check information. If things are submitted via FAMS, you can now complete your background check information in FAMS, and a lot of times that makes things go a lot faster. So if you're not on FAMS, Jim presented a lot of information about training and how to get in there, or definitely talk to your licensor because they can help you access if you've never gone in there before. So FAMS can help speed up the process, and then if it's delayed, please work with your licensor because maybe there's something happening. The other question is around resolving attendance with ACS and the child care assistance questions. So Meredith, do you want to just spend a minute on the child care assistance questions? One is on working with ACS, and the other is why does it take so long to work with ACS on getting a child enrolled?
Sure. So I always appreciate when we get feedback to hear how things are really going in the field, and we do meet regularly with ACS. So I'm going to take these questions and share them when I meet with them actually this Friday. I have posted in the Q&A some responses. So there's a couple of threads of questions. Some are about what is the process. So I will encourage you to go to their website and look through the process and make sure. One of the common things that we find out is I do know that there are a lot of forms in New York City that have to be completed, and it does outline all of the forms that have to be completed. There is also a specific email box that you can email about status. There's also a way to check on the status of provider payments, but I will pass this information on, and hopefully those resources I provided are useful. I've also added in the answers the link to checking on payments, as well as where the forms are for adjusting your market rate. So hopefully all those resources are helpful.
Thanks, Meredith. It can take some time. We do know the family information needs to be complete for the district to work on it. So definitely encourage the families to reach out to the district if they have questions about, if something's missing or if it's taking too much time. And then I know we have 1 minute left, but I want to just thank Andres for interpretation. Thank you so much for bearing with us this morning. Thank you to NYSTAC, Sarah, for running the show, Alana for coordinating all of us. And thank you to all of you. I hope you have a wonderful holiday season, and I hope you get to celebrate with loved ones and stay safe. And we're really grateful for all of you and all of your hard work. We'll talk to you all in 2025.